Well, the city of Detroit, as you know, is in the process of bankruptcy and is looking to cut costs any way they can. Well, one controversial way is by pushing many of its public sector retirees from their current city-run health care plans onto Obamacare exchanges. Is that fair? And who's going to pay their bill? Mark Aesch is the CEO of TransPro and a former advisor to the city of Detroit. Joins us today. Mark, good morning to you.
Good morning.
What did you do for the city of Detroit?
You know, they brought us in about 15 months ago because at the time they were literally leaving thousands of people standing at bus stops every day because they couldn't get enough buses out on the street to get people to work. So we came in and worked with them last year to both save money and improve the quality of their transportation system.
And before you came in, what, only 65% of the buses were running?
2 out of 3 buses would get out. I mean, imagine showing up at the airport and only 2 out of 3 times did the plane actually take off.
And how desperate were the people of Detroit who wanted the bus?
Well, you can imagine trying to find a job in a city where the unemployment rate is massive, right, and you can't get a vehicle to be able to get there. So you've really got to applaud Mayor Bang, who came into a tough situation trying to get buses out on the street and get people to work. Folks who couldn't get there were desperate.
And some people, you told me before we started, actually stopped buses.
There were people who stepped in front of buses with guns because they wanted to get to work.
That is just crazy. But it's endemic. It shows you structurally how screwed up Detroit has been for a while. Now they're doing anything they can. For instance, what do you make of the suggestion that perhaps they take the people, the retirees who are on the city plan right now, and shove them into the Obamacare exchanges?
You know, they may call this the Affordable Care Act, but the reality is by making some taxpayer in Wisconsin have to work harder to pay the health care benefits of a retiree in Detroit, that's both unaffordable and it's unfair.
Well, it is unfair. You know, for instance, people in other states, other cities, they've lived responsibly, so why should they have to pay for somebody with the situation they've got in Detroit, the Motor City?
We should not reward dysfunctional management. This is a wolf wrapped in sheep's clothing, and it will gnaw the American taxpayer to the bone.
What would you do if you could give, you know, Detroit some help, and man, do they need it? What's your suggestion?
We have got to get communities across this country to live within their own means. The city of Detroit overspends by 34% every year. The federal government overspends by north of 40%.
Right.
Moving the cost from Detroit to the federal taxpayer does not help anything. It just enhances how quickly America is going to be in trouble.
But see, the federal government can print money. Detroit can't.
Well, if we want to go buy bread with a wheelbarrow, that's where we're headed.
Oh, man, you were right about that. Mark Aesch, CEO of TransPro, thank you very much for joining us.
A pleasure.
Yeah, thank you very much, Mark. Catch up to you in the hall. We're going to talk a little bit more about that, too, at Detroit with Uncle Cracker, who still lives in Detroit.